Hi, I'm Kalia Coletta, and I'm a neurologist at Edward Hines Jr. VA Hospital in Hines, Illinois. And I'm presenting real-world evidence supports the use of transcutaneous afferent pattern stimulation for tremor control in Veterans Affairs essential tremor patients. Essential tremor is one of the most common movement disorders in adults, but unfortunately, treatment options are limited and even further limited by the patient's other comorbidities and medications. Transcutaneous afferent pattern stimulation, or TAPS, is an FDA-cleared prescription therapy for essential tremor. TAPS of the median and radial nerves, which feed back directly into the ventral intermediate nucleus of the thalamus, which we know is implicated in tremor generation, has been shown to be safe and effective for reducing upper limb tremor symptoms in essential tremor patients in both controlled clinical studies and post-market real-world studies. TAPS is applied at a frequency calibrated to each individual patient's tremor. In this post-market analysis, we evaluated TAPS therapy for symptomatic relief of essential tremor in a cohort of Veterans Affairs patients. Let's take a look at the therapeutic device. It consists of a stimulator and a detachable band. This band contains electrodes that are positioned to deliver TAPS therapy to the median and radial nerves of the treated arm. 58 VA patients who used the device for at least 30 days were included in this study. Each TAPS therapy session lasted 40 minutes, and users were advised to use the therapy as needed, such as when eating or writing, or during tasks when they needed their hands to be the most steady. In order to calibrate to the individual patient's tremor, the device prompted users to perform a postural hold. This postural hold was also performed before and after a subset of therapy sessions. Tremor motion was measured during these postural holds by an accelerometer on the device. Tremor power was then calculated using the accelerometry data, and tremor severity was quantified. Users were advised to use the therapy on an as-needed basis, and in this group of patients, 5.5 plus or minus 4.3 sessions were completed per week. Now, the fact that the patients are using the device on an as-needed basis is what accounts for the variation in the amount of tremor sessions completed. The efficacy of TAPS therapy was quantified using the improvement ratio, which was defined as pre-stimulation tremor power divided by post-stimulation tremor power. Let's take a look at this sample patient's motion capture data over 20 sessions. In this specific patient, when experienced severe tremor pre-stimulation, we saw an 88% improvement in tremor power after therapy. In sessions where the patient had moderate tremor power before therapy, 83.6% improvement was seen right after therapy was completed. Mild tremor sessions saw 79.6% improvement in tremor after treatment. If we take a look at the global patient-reported outcomes of the entire cohort, users were asked to rate tremor improvement after a subset of therapy sessions. And out of a total of 859 user-rated sessions, patients reported seeing an improvement in 54% of those sessions. There were 24 patients who had at least 10 sessions of complete motion capture data. When used during times of severe tremor, TAPS therapy provided significant tremor relief. 76% of severe tremor sessions improved into the moderate or mild ranges, and when used during times of mild tremor, 72% of sessions remained mild without any worsening. These data together suggest that TAPS therapy provides meaningful tremor reduction in cases of more severe tremor in patients who suffer from essential tremor. This post-market analysis of TAPS therapy in Veterans Affairs essential tremor patients is consistent with findings from prior clinical and post-market studies.